Hi, this is Eric Ruderman from Northwestern University in Chicago. I'm coming to you from RWCS in Maui. I gave a talk yesterday on recent updates in axial spondyloarthritis. I think there are actually two key things in the last year that are really going to change the way we approach this disease. First was the two trials that came out, one with ixekizumab and one with secukinumab, looking specifically at patients with non-radiographic axial spondyloarthritis and demonstrating efficacy, not surprisingly, with both drugs in that spectrum of disease. I don't necessarily think that that's a different disease, but what I think that does is it extends the use and the efficacy of IL-17 inhibitors now on top of TNF inhibitors from strict AS to patients who may not have radiographic change. So it covers the whole broad spectrum of axial spondyloarthritis, which I think is going to be helpful going forward as we think about this as a disease with a spectrum of presentations from pure AS meeting modified New York criteria to patients without radiographic presentation, and as long as they have MRI changes or an elevated CRP that suggests active inflammation, they're going to respond to this type of biologic therapy. The second big paper or study that came out within the past year was the phase 2-3 data with upadacitinib in AS, and this looks strictly at AS by modified New York criteria, showed the drug was quite effective. That on top of an earlier study showing some benefit with tofacitinib and another study showing that filgotinib was effective in AS, tells us that JAK inhibitors, which are beginning to become more and more important in RA, are also going to be useful in spondyloarthritis, including axial spondyloarthritis, and extends the use of these oral therapies to this population of patients as well.